As science and technology evolves, there has been more discussions on different topics of morality and the bottom line of right and wrong. Every couple of months, we see technology evolving to newer and better devices, and now scientists are discovering that they can manipulate human genetics, although many people are not sure if the manipulations are moral. There are pros and cons to all things in science, but genetics is a sensitive topic for many to decipher between what is morally right and what is morally wrong. For example, scientists are discovering that they can give parents the option to genetically make their embryo and future child genetically perfect, and they can even manipulate what their physical features will be. Now, some may believe this is morally wrong because it goes against nature and baby embryos should never be changed at all. The counter argument is that genetic manipulations can have a positive use to take out genes carried down through family members that can impact the health of the child, such as Down syndrome, cystic fibrosis, Huntington's disease, and even different types of cancer. If one could potentially stop their child from inheriting a disease, they could have the option to do so, but the main point is this morally acceptable? The ethical theory that can be thought of when discussing genetic manipulations and mutations is soft universalism. Soft universalism can be helpful to solve some conflicts because it is finding a common ground. If we believe that somehow, under the surface of antagonism and contradiction, we can still find a few things that we can agree on, even if we choose to act on them in different ways, then we believe the existence of a few universal moral values. Some soft universalists' main point is to seek common ground beneath the variety of opinions and more. To conclude, soft universalism connects to figuring out the bottom line of genetic manipulations and finding a common ground on how far science should take part in modifying humans and what would be the basic line for right and wrong. It all depends on how far one would want science to be involved in the making or producing of one's child, or if they should be involved at all.